Eczema or dermatitis. A type of skin disease. Eczema and dermatitis terms used as synchronously. Eczema is characteristic of inflammatory red response of skin to both exogenous and endogenous agents. This skin condition is very common in children, but adults can get it too. Types, cause and symptoms. Exogenous. It's irritating contact eczema because of solvents, paints, detergents, acids, alkali and abrasive dusts etc. Strong irritants often causes acute eczema and weak irritant often causes chronic eczema. Symptoms is redness, itching and sometimes blisters can be seen. Allergic contact eczema causes due to delayed hypersensitivity allergic reaction by the irritant after contact. Endogenous. Atopic eczema is because to a genetic predisposition of excessive IgA antibodies. It usually begins in childhood, often in the first 6 months of the life but can occur at any age. Patients with atopic eczema have tendency to develop other allergic reaction like asthma, urticaria, hay fever. It's usually chronic or relapsing. Dry skin and itching, which may be severe, especially at night, and redness. Characteristically, rashes occur on the neck, cheeks, elbow and knee creases, and ankles. Seborrheic eczema. It often runs with family and associates of tendency of dandruff chronic form. Possible causes excessive growth of organism Malassezia furfur or its yeast form, Pityrosporum ovale. High risk factor is HIV patients. Redness, skin flakes, dandruff, on your scalp, hair, eyebrows. It produces a rash on the scalp, face, ears, and occasionally the mid-chest in adults. In infants known as cradle cap, it can produce a weepy, oozy rash behind the ears and can be quite extensive, involving the entire body. It is slightly more common in men than women. Dioicoid eczema, nummular eczema. It's a common type of eczema that can occur at any age. It looks very different than the usual eczema and can be much more difficult to treat. It's often seen in limbs of elder males. Causes is unknown. It's commonly look coin-shaped on the skin. The spots may be very itchy or not itchy at all. They may ooze clear fluid or become dry and crusty. Pink, red, or brown in color. Dyshydrotic eczema. It causes small itchy blisters to form on your hands and feet. It's more common in women than men. Causes is unknown. The skin can scale, crack, and flake. It's sometimes painful. Hand eczema. It is very common. 10% of the population has this type of eczema. It is the result of both internal and external factors including genetics and contact with allergens or irritating substances like chemicals. Dryness, redness, itching, pain. It may form cracks in the skin and blisters. Asteatotic eczema is commonly seen in lower legs, in hospitalized elder patients. Stasis dermatitis. It's sometimes called venous stasis dermatitis. Stasis dermatitis is skin inflammation that develops in people with poor circulation. Stasis dermatitis happens in people who have blood flow problems in their lower legs. It most often occurs in the lower legs. Legs may ache or feel heavy. Swelling around the ankle is often the first sign of stasis dermatitis. The skin over those varicose veins will be dry and itchy.
Visit our website www.medihelp365.com. Find doctors, hospital, medical service providers. Read useful articles and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical related videos.